Welcome to the video lecture of NUR1216 Communication in Health and Community Settings. Today we will talk about the communication skills in community. So what is community? It is a group of people living in the same place or having a particular characteristics in common. So that is community. And why community is important in health and community settings? Let's think about some scenarios. I'm sure you have the experience of health check in the health centers in Hong Kong. Whenever you are a primary school student or when you are a secondary school student. Who is in charge for this kind of health test? Usually it is the nurse. There will be vision tests, hearing tests, or individual health counseling. And so on the other hand, if you are the nurse, so you will encounter different age of teenagers or child. If you are facing to a young child, then usually you will use a more interesting tone to talk to them. Or when you are facing a secondary school students, the student will suppose you handle them in an adult way, that is, treat them as an adult. So there will be, of course, different communication skills or talking skills to different age of people. And also we can think about other scenarios. For example, in the health center, there may be some patients or clients which is not a Chinese or their first language is neither Chinese nor English. For example, in the health center or the baby clinic, there are a number of new mothers which are not Chinese in Hong Kong. So they will bring their babies to the health center for vaccination and regular health check. The nurse working there will need to face and talk to these kind of mothers in English or limited English, I should say limited English. And the mother is hardly to understand English, that he or she, the father or the mother, may know very little English or not even any Chinese. This is my real experience that when I bring my baby to the health clinic, I witnessed that there is a Vietnamese man bringing his newborn child to the clinic. He and his wife cannot speak Chinese nor English, so they are basically using their body language to communicate with the nurse, which is very difficult for communication. Another case is that you have come over to the presentation about some communication barriers. One of that is the hearing problem. And hearing problem is very common in elderly. And so if a nurse working in the outpatient clinic, he or she may encounter communication problem with the elderly client because the client can hardly listen to the nurse voice. And of course there are much more communication problems in the communication setting. Of course, I'm not meaning that effective communication is only applicable to community settings, but it is vital and considered to be a fundamental core in community, or we call public health nursing practice. Why is that so? Because when we look at about the competencies of community or public health nursing, it is one of the main core. Communication skills is the main core of their skills they need to know. As you can see in this table, there are lots of areas mentioning about the importance of communication skills in community nursing. You can spend time and take a look at every point, but I want you to look the first two sentence. Basically, it talks about the importance of communication skills in community settings. Communication skills focus on assessing and addressing population literacy, that you need to let the public to know about health. Soliciting and using community input. You need to use the input correctly and use the resources correctly. Communicating data and information, facilitating communications. As you know that in the community, not everyone is active to communicate with the health workers. So you need to encourage them to facilitate the communication or start the communication in your way first. And communicating the roles of government, healthcare, and others. If you work for the government, for example, you are a nurse in the Department of Health, then you need to tell the public about the role of a government in healthcare settings. Or if you are in a private sector, then you will need to communicate with your client that the service your clinics is providing, etc. So you may spend time on reading these two slides. And furthermore, I quote one reference telling you again that the importance of communication in health and community settings. It is to maintain relationship and advocate effectively with individual client. I will talk about more about what is the importance of maintaining relationship with the public. It is a little bit different than you are working in the hospital or in a large scale of health organizations. Working in community, maintaining relationship is the most important. And then you need to provide quality health care and health education. So no matter it is the clinical procedures or some health education, they are both important to the community settings. And initiate public health policy. As I mentioned, if you work for the government, then there are some policy you have to carry out. You need to execute the health policy. For example, the vaccination, you need to execute the vaccination procedure in the public health centers. And then you need to implement programs designed by the government or by the private sector so that you can meet the needs of clients. So let's take a look to the flow chart of the health service in Hong Kong. We can simply divide it into two parts, the public and the private settings. Under the public settings, the Food and Health Bureau, they are in charge of all kinds of public settings of healthcare services and divided in two parts. One part is directly under Food and Health Bureau, which is Department of Health. You can see a lot of service provided by the Department of Health. And you can see some dotted line above the hospital authority, because it is not directly under Food and Health Bureau, but actually the government is funding the hospital authority to run and manage the public hospitals, including the public hospitals and GOPC, the general outpatient clinics, and SOPC, special outpatient clinics. And on the other hand, if we look at the private sectors, there are some private hospitals in Hong Kong, and a lot more. We may have more chance to contact with this kind of practitioners. Is that the private practitioners, including the general practitioners out in downstairs of your community areas, residential areas, and also there are private Chinese practitioners in Hong Kong, a lot more than a few thousands. So the three circles circle out that the community setting, where are they? Actually, they distributed in both public settings and private settings. No matter it is under Department of Health, hospital authority, or just private settings, there are community settings all around in Hong Kong. The next part, I will introduce the service of General Outpatient Clinic in Hong Kong. It is under hospital authority. They are committed to provide community-based primary care services. There are altogether 73 GOPC located in Hong Kong, and they target different kinds of patients, not just the elderly, but also the low-income individuals and patients with chronic diseases. In 2017 and 2018, there are over 6 million people of attendance to GOPC. Of course, it doesn't mean that everyone in Hong Kong has visited GOPC, because some patients may have numerous attendance to certain GOPC in 1 year, but it means that every day the GOPC serve thousands of patients. That is a very large number. Generally, there are two categories of patients in the GOPC. First is the chronic disease patient, but they are in stable condition. Of course, they are not in the acute conditions. If they are in acute conditions, they are admitted to the hospital already. So it means that maybe some diabetes patient, hypertension patient, so they require some follow-up. If they need the follow-up appointment, then the clinic staff will arrange an appointment time for them after each consultation, so they will have regular visits to the GOPC. And of course, there is another category of patient, is the episodic disease patient. Maybe some mild symptoms, maybe the influenza or cold, then they may reserve the consultation time slot via the telephone appointment system in the next 24 hours. So they do not need to queue up outside the GOPC anymore. If you talk to some elderly, they may share with you that, in the old days, it is very difficult to get the consultation in GOPC. They need to wake up at 5 a.m. and then queue up in the entrance of the GOPC clinic. Nowadays, they don't need to do so. They only need to call the telephone appointment system to make an appointment. However, I have tried this kind of appointment system. It is not very user-friendly for some new user, or if you have hearing problems, then it may not be too user-friendly. Then you may need some help from others to make this appointment. Okay, what kind of service is provided in the GOPC? Firstly, it is the nursing service, such as the drug injection or dressing. For example, if you have a wound which you have been discharged from the hospital, but you still need to have dressing changed every day or every few days, then you will go back to the GOPC and have this kind of nursing service. Next is the health risk assessment and the follow-up care for patients, for example, with DM or hypertension, as I said in the previous slides. Then there will be some target treatment services, for example, the wound care, or by the chronic patients, or the allied health professionals such as the physiotherapists. They will do some target treatment to the chronic patients. Last but not least, there may be some health campaign, for example, the smoking cessation program, and they will attract the smokers to quit smoking in this kind of program. So the above are the services provided in the GOPC. What is the impact on communication with this kind of services? Firstly, as I said, there are thousands of people visiting GOPC every day or every week. Then it means that a high volume or patient turnover that they need to manage every day. So the health workers need to be multitasking. They need to provide hands-on care, and they need to address the messages from patients and perform telephone triage or follow-up calls. you may say that, oh, as they already come to the clinic, why you have to call them? Firstly, there is a chance that the patient do not come back for follow-up on time. They may miss the follow-up, they forget the follow-up, or they don't want to come back to the follow-up. But if the patient needs medication and they miss the follow-up consultation, there may be a risk that they will be out of medication. Then that will be a health risk. And for some patients, for example, if the wound nurse need to follow up about the wound care of the patient, they may call the patient as well and ask them if they have followed any instruction provided by the nurse. Secondly is the autonomous. The nurse or the health workers, they have more autonomy to be empowered, but there is absence of support or lack of support. It is another challenge. They will always have to, of course they have the support from the overall clinic, and the physician is more likely to be present in the clinic settings, but nurse-to-nurse collaboration may not be always available. That is, you are the only one facing the patients. You can imagine in a clinical inpatient ward, there may be 10 or 12 nurses working together in one station. But in the GOPC, there may be only 1 or 2 nurses working in one partition or one cubicle. Also, the nurse or the health workers need to be talkative. Why? Because they need to present some preventive health education on various topics such as health diet, diabetic living, blood pressure management, etc. Just like when you are doing the presentation to the teachers, but you need to present to the client. They need to educate their patients on this kind of topics. Of course, there is also education in the hospital setting, but it is often tailor-made in one acute problem. For example, after birth, after delivery, the nurse in the ward will present to the new mother that how about the wound care. It is very tailor-made. But for the GOPC nurse or a community nurse, they need to be talkative on many topics. And finally, it looks like running a business, especially for those in the private settings or if they're in a small scales of a clinic. For most of the parts, you are not trained to have business mind in this nursing school. So if it is some basic techniques like sending and receiving emails, it may be easy for you. But if you also need to do some projection on the financial setting, or if you need to do the presentation slides on your own to the patient, then it may not be that easy for you. After introducing the GOPC service, another hot topic about the community settings service in Hong Kong is the outreach nurse, which is the community nurse. In 2017 and 2018, there are over 2 million visits by the community nurses. Of course, there may be some other community health workers such as the physiotherapists or occupational therapists, but these kind of visits are mostly done by the community nurse. This is again my real experience just in the past months after my delivery. After my delivery, I have received the wound care from the community nurse. I thought that there are special nurse to take care of the new mothers. So when I talked to the nurse, is the next appointment also a new mother? Then the community nurse tell me that no, it is an elderly person live near to you. After you, I will go and take care of him. Then I realized that the community nurse is very all-round. They can take care of the new mothers, they can take care of the elderly or some disabled, so they have very wide spectrum of skills. So what is the difference between community nursing and hospital nursing? Firstly is the different environments. The community nurse, they visit people's home and carry out personal risk assessment every time when they enter a new home. For example, when the community nurse, they visit me, they will firstly inspect my home environment. Is it safe for her to stay? And is it safe for the patient or the client, which is me, to stay and receive wound care? They will ask for a clean room, a clean bed, so that they can have the wound care to me. This is all relied on their own abilities to solve the problem. For example, if my home is such a mess and has no clean space for any wound care, what should the community nurse to do? This is depending on their own ability to solve this kind of problem. In hospital, the nurse environment is a lot more controlled and contained. Of course, there will be clean space, and of course there will be beds, although that the environment may be a little bit packed and tight, but it is still a controlled environment. Secondly, every time when the community nurse leaves the home, she also needs to assess that if it is safe to leave the patient alone. In my case, who is the client? Of course, this is me. I'm the new mother. But also, the nurse will also inspect that if my baby is safe to stay with me. For example, is my emotion stable? Is the baby in a safe area, or do they have their own? The baby has his own bed, etc. So that they need to take care of the safety of the patients. Whereas in the hospital, the nurse is able to hand over to the next section of staff, another nurse, after they finish the shift, and they know that their patients is usually in the safe hands. Secondly, the community nurse is usually work alone. Although they have a team members, they will have regular meetings every morning and after they return to the office. But when they are working in client's home, they are usually alone, independently working. So it is more skillful for them to tackle different kinds of patients. As I said, there may be new mothers, there may be elderly, there may be chronic patients, there may be some disability patients they need to take care about. And the relationship with patient become crucial in the community patients. In the hospital, the nurse may only see their patient once in a lifetime. And of course, as a patient, they don't want to see the nurse so regularly. That means that they are admitted to the hospital. But in the community settings, in my case, I received the community nurse service 5 times in a month. It means that they need to build up a certain relationship with me. And for some chronic patients, they may have more regular visits with the nurse. They may meet the nurse more regularly. So they need to build a long-term relationship that they may visit several times in a week or month. This is a sharing from my community nurse. She said that she had a client which is not supposed to be met so regularly. But this elderly, she is so concerned that he didn't receive the health education from her. It means that the elderly did not understand the health messages delivered by the nurse. So the nurse decided to give more regular visits to the elderly, which almost is one time every day. So now we come to another section of this lecture. It is talking about the characteristics of client in the community. There are three types of clients in the community. Firstly is the home-based clients. They usually discharged from the acute hospital setting. You need to know that who and how to care of the client. And of course, if they stay at home and need someone to take care of them, usually if there is a family member available, that is the best situation. But usually the family members are not available to take care of a long-term chronic patients, which is home-based, living with you. You need to spend all of your time to take care of. So usually there will be a carer. You will hire a carer, which may be the domestic helper or some health workers working in your home. So there will be a financial problem created because you need to spend money to hire a domestic helper. And then the communication with the client, the carer. For example, the domestic care helper. If it is a Philippines domestic helper, then is the elderly able to speak English, or is the family member able to communicate with the domestic helper and deliver what they want? What is the client's needs? So that, for example, the client need to take 3 types of medication in 2 different time slots. Can you deliver the health message or the instruction to the domestic helper, and do they follow your instruction? And then the nurse need to know that and find out the key person of the case based on the objective and subjective information and past record. For example, the client has 5 daughters and son, but only one of his sons and daughter in charge of the client's situation. So if you find his son, the son knows nothing about his father, then you will feel very embarrassed when talking about the situation, and he cannot make any decision for you, and he cannot give any advice for you about his father medical history or record. But if you find his daughter, who is the key person of the case, then you can easily find what you need. The second type of client, they are usually institutionalized. It means that they may living in the nursing home, or in some they have some daycare centers. There may be some severe chronic cases of many kinds, for example, dementia, after stroke, or disability patients. But this kind of patients, if they are institutionalized, they may not always be voluntarily admitted. Just in many families, the son and daughters find that they have no time, no space for a domestic helper, and no money to move to another place. They will admit their mother or father to the institutions. Then the mother and father will be very emotionally sad to be admitted to this kind of institutions. So communication with the family is the key. And the third type of client, it looks easier to handle, but actually not. It is the general community. It means that they may not be severely ill, or they may not have any condition to be followed up. It is the mass public. But they also require multifunctional community nursing, such as home visits, screening, health education, and seminars, and of course for the nurse to organize some health activities, they have admin works and proposal writing. So you need to focus on the prevention and primary care to this general community rather than direct treatment. So almost all the clinical skills is not useful when you are handling some general communities. So nurses need to establish relationship with the local stakeholders and connect with different working units so that to establish a good relationship with the general communities. As I said in the beginning of the lecture, maintaining a good relationship is always useful when you are facing to the general community. So effective verbal communication and social manners, what you have learned in this lecture or in the previous lecture of this course would be very useful rather than the fundamental of nursing. Okay, we look back to the different aspects of clients, the home-based clients, the institutionalized client, or the general community clients. There are different techniques when facing to them. The home-based client and the institutionalized client, we need the same technique deliver in different ways. And for the general public, we have another set of skills. Firstly, for the home-based client, we need prepare well before we handle them. Firstly is the medical history, discharge summary. You need to know what happened to them, how are they treated in the hospital or in the acute setting, and how they are discharged from the acute units. Some information is less likely to be recorded, not in the discharge summary, not in the medical history. You can't read it in some text. For example, who is the carer? And how is the living quality of the client? It would not be written down in the discharge summary. For example, the client live alone and he has no one to take care of, or his living condition is very poor. You need to find it out yourself. So every case is unique. And we can say that long-term chronic illness, it affects the physical, mental, and social wellness. The stereotype communication in your hospital setting may not be applicable to home-based client because everyone will become unique, and long-term of chronic illness can affect some people's mental and social wellness. They will become lonely, they may be very upset, etc. So we need to give sympathy to the clients because they have poor emotional wellness. So applying sympathy techniques can build up relationship with your client. As I said, you need to find the condition of the client by yourself. How to find it out? Listening and observation. They may have limited access to outside, so they have no one to share their feelings with, no target. So when you go and visit them, you become their target. So they will love to share with their trusted person. So if you build up a relationship with them successfully, you will become their trusted person, and they will love to share their big things and small things. For example, what they ate yesterday. So nonverbal communication is also important. For example, optimal skin contact with the client will show your love and care. For example, holding their hands. And also observe the relatives, the family members. Observe their nonverbal communication. For example, if you care about the client, if the family member care about the client, they will show in the verbal way, of course they will say, oh, I care of my mother, but if he only say so but not visiting his mother, actually, then the non-verbal communication telling the truth that the son is not really taking care of his mother. Another technique is the risk management. So we have to observe and keep alert that if you find there is some new wounds induced by the clients himself, or it is an abuse case, someone hits the client, for example the carer, as you may find some news that the carer, the domestic helper, did not treat the client well and they abuse, physical abuse, or to the client. And sometimes if the carer is the family members, is that always safe to keep the family members and the client together? Please be reminded that there is long working hours of the carer. Even if you are the client's daughter, you will have the moments that you lost your patience and you find that I am so trapped by my mother to take care of him. I take care of her. I have no my own space, or I lost my freedom. I cannot go out with others. I need to spend all the time taking care of my mothers. Then the carer also has the point of moments to be impatient and lost their control. So for the institutionalized clients, we have the same techniques but they differ in different ways. Of course, firstly, we also need to be well prepared for the medical history and discharge summary. And during the stay in the institution, we can observe the frequency of visits by the family members and the lifestyle of your clients. Before they are admitted to the institution, if they are living alone or they're living with their family, and is the family taking care of the client well? So you need to gain the trust from the family member. Again, sympathy is useful. Apart from the client, the carer also face long-term pressure, both emotionally and financially. Emotionally, as I said, they may not feel good to send their family to the institution. They may be regretted and say that, oh, I'm not a good son, I'm not a good daughter, I cannot take care of my mother or father by myself, I need to send him or her to the institution. And financially, as nowadays the government is not providing enough institution support to the long-term patients, the family need to pay a lot if they want to give the family member a well environment of staying in the institution. It may be thousands of dollars a month to stay in the institution. So there is also a financial problem. And listening and observation is also important, because there are sometimes the client, they want to escape from the institution. So you need to observe their action if they are trying to escape, if they have packing their luggage, or they have been dressed well and try to get out of the institution. And we need to improve our listening skills so that we can understand the client's information and the actual feelings of family members to minimize the communication barriers. And nonverbal communication is common to find in the clients with limited mobility, because they have difficulties to express their feelings. So you need to have some skin contact with them, holding their hands again, or speak in a soft tone. As you learned in the verbal and nonverbal communication lecture, the tone is also a type of nonverbal communication. It can show your love and care to the clients. For those who are unfortunately abandoned by their family members, you need to give them more love and care. And the risk management for some prolonged staying in bound area, the client's emotion would be easily affected. The institutionalized client, they have limited space to stay in, and the nurses need to identify case which is relatively difficult to control. Because the safety of yourself, the nurses, is also important in communication. For example, the dementia client, they may also have some violence actions. And finally, we need to involve some close family members when communicating with this type of clients so that we understand why they have this kind of violence action because of their illness or they personally have this kind of violence action. So what is the technique used for general community? Firstly is your interpersonal relationship. The nurse need to maintain good interpersonal relationship with the local community service unit. For example, it's the community centers and they have different types of workers working there. For example, the social workers or the admin officers. If you have good interpersonal relationship built up with them, then it can facilitate your work a lot. Because you need to carry out some activities in this kind of community center. For example, the health screening program, you need to use the lobby or the function rooms. Health seminars, again, you need to use their space. And health checkups. Sometimes the workers can help you to be one of your manpower to carry out this kind of health checkups for those simple procedures. For example, measuring the blood pressure and measuring the height and weight. If you have good relationship with the workers, then they may help you. The health seminars. There are numerous of admin duties before you carry out a seminar. You have a lot of chance or experience to attend a seminar. For example, a seminar held on 3 p.m. to 4 p.m. Then you arrive the venue at 3 p.m. Then you leave at 4 p.m. But if you organize a health seminars, this is another story. It may spend you weeks before to plan admin duties. For example, you need to design your poster, you need to promote your activity, you need to plan the time well before you book a venue, and then after the event, you need to evaluate the effectiveness of your seminars. That means that you need weeks before to organize a seminar, and you may arrive the venue early in the morning that day, and then after that you need to have evaluation to see the effectiveness. And the nurse also need to know how to communicate with the elderly. For example, if the elderly has mild or slight dementia symptoms, they may forget to attend your seminars. Then how can you remind them effectively? For example, if the elderly goes to the community center every day, then you may post the poster and ask the worker to remind your clients to come to the health seminars. And one-on-one guidance. Because you are a professional, so your professional guidance are so important to the community residents because they know you are a professional. So they may ask you different kinds of questions related with health after they complete the health screening or checkup activities. So for example, if they find that they have a little bit higher blood pressure, for example 135 and over 90, they may ask you about the healthy diet or if they need to take the medication now. So the nurse, that is you, may need to spend some time having more in-depth communication with them. Sometimes they know about that I have a little bit hypertension, but what is their worries? They will tell you that, oh, I have the high blood pressure whenever I has argument with my husband, or I have some argument with my child, then it is blah 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 blah. It may spend you 10 minutes to listen to certain worries, both physical is their high blood pressure, but emotionally they know what is the cause of their high blood pressure. So after you listen to their worries and then you give them certain advice, for example, healthy diet or try exercise, or how to calm down your emotions if you have arguments with anyone, it may have a very good relationship to build up using the one-on-one guidance, but it is time consuming, you have to know that. And then consultation with family. Some patients, they may not available to the health seminars or activities, but their families are present. For example, if you are talking about a healthy diet seminars, some mothers will come and tell you that, oh, my son, he started to work last year and he seldom come back for dinner now. So every day 3 meals he eats outside and it is not very healthy, blah blah blah, blah. And then he may ask the family, the mother may ask for your advice and healthy diet when they dine outside. Then they are becoming the valuable resources, because the mother, the one who present in your seminar, is the bridge, so that you know the actual one who need care, the situation in the community. Even the young people, they may have health problems, especially their diet is not healthy, so they may gain weight in the days they start working. It is very common for young people to gain 10 pounds or 20 pounds once they graduate from the college and start working in the first 3 years, because in the college they may have time to go for exercise and they're more active, but after they start working they will spend all the time in the office and they may stop their exercise and they will start having very unhealthy diet, and this is the reason and one of the risk factor of many kind of chronic disease, because you did not care about your health in the early days, and then in the later age you will suffer from a lot of chronic disease.